Well, the Ebola outbreak in West Africa has killed more than 1,500 people since March. Aid organizations warn that food shortages and inadequate facilities are making the situation even worse. Today, the head of the Centers for Disease Control and Prevention said action is needed now if there is any hope of containing the outbreak.
Despite tremendous efforts from the U.S. government, from CDC, from within countries, the number of cases continues to increase and is now increasing rapidly. And I'm afraid that over the next few weeks, those numbers are likely to increase further and significantly.
And joining me now with more on this is Dr. Devi to talk more about this illness. Doctor, good to see you. It's been a long time.
Thank you, I know.
Yeah, it's great to have you on the program. So, Director Frieden says today that there is a window of opportunity to tamp this down. What happens if this window closes?
Yeah, so it depends which point of view you're looking at it from. So from our point of view, I mean, the danger is that it will spread, that it will get out of control and affect other countries like the U.S.
Yes.
I mean, if you're looking at it from the point of view of the West Africans, though, I mean, there are a lot of barricades right now to them getting food, to them getting medical supplies. A lot of airlines are cutting off their contact with West Africa. So the danger is that the people who are healthy there will also get infected and that all of them will be kind of sealed off and just either have to fend for themselves, either survive or don't survive.
So if you are leading I'm going to put you in charge here. I like to do this with you.
Okay.
Because you can handle it. So if you're leading the international effort from where we are right now, forget about where we were a couple of weeks ago, a month ago, 2 months ago, from where we are right now, what do you need? Money, material, doctors, personnel, what do you need to contain this?
Well, I think the first thing is that we need to win the hearts and minds of the people, especially in West Africa.
Why is that necessary? Isn't it clear that this is killing people?
No, so it's not exactly clear. I mean, there are a lot of superstitions there. There are a lot of skeptical people who are very worried about Americans and other healthcare workers who are out there. I mean, just a few weeks ago, a quarantine center was raided. So that's a huge problem because they freed all the patients with, I don't want to say freed, but released all the people with Ebola. So the thing is, it spread out into the community. So that means it's spreading even faster. The second thing is they took all these medical supplies, blood-stained bed sheets, all kinds of stuff, gloves. So you're spreading it, but you're also causing a problem for the healthcare workers who are there right at that moment. How are they going to protect themselves? And that makes other people more skeptical about going into health.
Superstitions, mistrust, and things like that really are hurting the effort to contain this right now?
Exactly, because it's spreading faster, and healthcare workers will be afraid to go to that area if they're concerned that they're going to be raided. I mean, the other thing to think about is, of course, vaccines and treatment, but a lot of these people are dying from other things like starvation. If they don't have food and they're trying to battle a deadly disease, I mean, they're going to die from a combination of those things. So,
what are your thoughts about human trials starting?
I think it's a good thing. It's a promising thing that it's starting, but it might face the same type of problem that, we need to have people who trust American healthcare workers and trust these efforts to be able to volunteer, to be able to take the vaccine, to be able to use the treatment. So that's a little bit concerning as well.
Why is this moving so fast? Look, we're talking about the World Health Organization. That's an organization that's designed to contain this, identify it and contain it. The CDC, same thing, identify it, contain it. And yet it is moving so quickly and seemingly out of control with a limited window to contain it. Why is it moving so quickly?
Well, I think one reason is that this is happening in a poor but populated area. So it's populated, so it's able to spread quickly. But because it's poor for the most part, they're not able to get access to other types of treatments. They might not be able to treat Ebola directly, but they can actually, in other places, they might be able to contain it with isolation, with other types of supportive treatment like IV fluids and other things that treat the complications of Ebola.
So does it take, I'm going to put it this way, does it take something like this virus making its way to the West, whether it's Europe, whether it's the United States, for there to be the kind of mobilization that is necessary to bring this under control?
Well, I hope not. I hope that wouldn't happen. But I do think that people are becoming more aware of it. I guess it's a matter of just organizing ourselves in terms of getting the vaccines going, kind of cutting through the red tape to be able to figure out the treatment. If we have something, to be able to get it out there faster. And then again, getting to these people, whether it is, people who are able to dock their ships or their planes, so they can give them food or medical supplies. Otherwise, how do they get that as well?
Right. Dr. Devi, great to see you. Come back and see us again, all right? Soon.